What are medical experts saying about all this back and forth?
Well, Chris, they all agree that it's frustrating that when at the very beginning, the World Health Organization didn't really seem to be on the same page as these leading organizations that you see here, American organizations that had recommended the COVID vaccine for pregnant women. Now, I do want to show you the World Health Organization's website and their recommendation. I'll admit it is a little vague, but I want to read it so you hear it directly. They say, "We don't have any specific reason to believe there will be specific risks that would outweigh the benefits of vaccination for pregnant women." Well, here's Dr. Jennifer Ashton with ABC News and her take on all this.
The reason why World Health Organization and CDC and NIH and ACOG, by the way, are not crystal clear with their recommendations with respect to pregnant women getting these vaccines is because it hasn't been formally studied yet in pregnant women.
All right, so here's what the CDC website says. It says studies in people who are pregnant are planned. So we know more information is coming. But what are medical experts saying about the COVID-19 vaccine in pregnant women right now?
What ACOG told me, and the CDC definitely echoes, and I know the FDA does also, is that this should be an option for pregnant women based on the woman's individual risk factors.
The type of vaccine it is, the mRNA vaccine, we know historically with other types of vaccines like this, that it is very safe and minimal risk. And so that's why we recommended it from the very beginning for our patients.
All right, so let's say that you're pregnant. You've decided that you are going to get the COVID-19 vaccine. Now the big question becomes, when during your pregnancy should you get it? Well, here's Dr. Ashton again, and also Dr. Jay Staub, who is an OBGYN practicing right here in North Texas.
The new director of the CDC says, if you're going to get it while you're pregnant, maybe avoid it in the first trimester. As a practicing OBGYN, I would say the same thing.
In my opinion, because I believe in its safety, I'm advocating that my patients get it just as soon as they can.
All right, so as you can see, those are two medical experts that have different opinions on when during your pregnancy you should get the vaccine. But just a reminder, COVID-19 is still very new, right? It hasn't been around for that long. There are still more studies being done. There's still more information. The vaccines are so new. So just a good reminder that if you're pregnant, sit down with your doctor and have your own conversation because, of course, Chris, every case is going to be different.